Hello, everybody. Thanks for clicking on the video again. This is a video that is strictly for LPNs again. In this video, I'm going to compare the educational requirements for an LPN versus the educational requirements for a medical coder. We're also going to talk about salary and work environments. So if that's an interest to you, keep on watching. So now we're going to get started. So as you see in this graph, we have the LPN requirements on the left side and the medical coder requirements on the right side. So in terms of education and entry for an LPN, you need either a practical nursing diploma or a certificate, and the programs usually last between 12 and 18 months. When I became an LPN, my program was 12 months. And the educational requirements for medical coder are a certificate or associate's degree, and their coding programs can be 6 to 12 months, and no degree is required for many roles. So you can just self-study and get a certification. And that would be that would grant you entry into the profession. So then we're going to talk about licensure for the LPN. So as an LPN, you have to have a state license from the State Board of Nursing. And to get that license, you have to sit for an exam called the NCLEX PN. For the medical coder, credentialing is voluntary, and I have the two most common, which are the CPC via AAPC, and that is the American Association of Professional Coders, and the CCS through AHIMA, which is the American Health Information Management Association. And there is no licensing required for medical coder. You just need certification from an established accredited, well, not even say accredited, an established agency like AAPC, agency or organization like AAPC or AHIMA. Then time to enter the field for an LPN. Once again, it's usually 12 to 18 months, depending on the program you attended, and you also have to sit for your NCLEX. For a medical coder, you can enter the field in as little as 6 months with a focused coding program, and that is really true. I know I have helped nurses get into it and it's been like it'll be about 5 or 6 months, and they're like fully employed from the time they complete the program, get certified, and start interviewing. Now we're going to talk about work environments. So the work environments for an LPN it's not so much hospitals anymore. Like when I was working at the bedside, I worked at a lot of hospitals, but now because of a lot of hospitals have magnet status. Magnet status requires all RNs to have at minimum a BSN. So it's not so much hospitals anymore, but it's nursing homes, clinics, home health, and long-term care. To contrast, the work environment for a medical coder is a lot of jobs are remote, so you work from home. You can work in hospital, billing departments, physicians' offices, and also for payers. So for an LPN, remote work is rarely available. There are some LPNs are starting to get roles in utilization review and chronic care management. Those positions, there are some positions that can be done at home, but for the most part, LPNs work in direct care. And conversely, for a medical coder, remote jobs are widely available. I mean, I've been in medical coding now for a little over 12 years, and 11.75 of those years I worked from home. I only had two opportunities that I had to go into the office, but I wasn't employed long at either place. One was a contract for like 6 weeks. Then we're going to talk about scheduling. So for an LPN, it is usually shift-based, and you either work 8, 10, or 12-hour shifts. You could work nights. Weekends are usually required. You usually have to alternate weekends, and holidays are very common. You can typically rotate holidays, or you just find someone to cover. But as a medical coder, you typically work a Monday through Friday schedule. Now, you do have a lot more flexibility because they say business hours, but a lot of places will work, they will have like a 6 a.m. to 6 p.m. type of schedule where you can work 8 hours at any time in between. And they also have a lot of flex time. So if you have to go to, I've done it. If I have a doctor's appointment in the middle of the day, um, I'm perfectly able to go to my doctor's appointment, and I can either make up that time. Either that same day I can come back and just work those extra hours. If it was 2 hours, I would just work my 2 hours extra, or I could push it off to the weekend as long as you make up the hours for a lot of facilities. As long as you make up those hours during the same pay period, it's fine. So you have a lot more flexibility. And then we're going to talk about physical demands. So, as we all know, as a nurse, there's a lot of standing, there's a lot of lifting, patient transfers, and a lot of frequent movement, walking up and down the halls, checking on patients multiple times per shift. Then, for to compare that with medical coding, the physical demands are very, very low. Like probably the most strenuous thing you'll do is pick up your coffee cup, but you primarily work at a desk, and you have a computer that has usually you have your laptop screen, and you have usually two additional screens, and it really, really does help your productivity. Like I could not do that medical coding work with just one screen. I can't believe that I used to do that, but now that I have multiple screens, it's a game changer. But anyway, now we're going to get into compensation, and I know there's going to be people who say, oh well, these are really low salaries, but it's average. We know that it varies by region. We know that typically, if you're along the coast, the East Coast and West Coast, and especially if you're in the Mid-Atlantic to the Northeast, you typically make more than people in the Southeast, and everybody on the West Coast makes more money than usually most people on the East Coast. So we know that it varies. These are averages. So the average LPN national average salary is approximately $54,000. Then if you compare that to a medical coding average annual salary, it is approximately $58,000 with credentials. And I would honestly say if you are an LPN and you go and get a coding credential, you will make definitely way more than $58,000. I can promise you. Because when I first got into it 12 years ago, I made more than $58,000. So now we're going to talk about salary growth potential. Now, this is where medical coding just leaves being an LPN in the dust. Because with an LPN, if you don't go back for some kind of advanced education or go back to obtain your RN license, there's not many opportunities for you to remain at the bedside or even move up into management in a lot of places. But if you compare that with the salary growth potential of a medical coder, it is very strong because CDI, auditing, compliance, and management roles can reach 80,000 to 95,000 plus. And I can tell you, as an LPN that has coding credentials, I personally don't have a degree, and I have routinely interview for roles that are between 90 and 100,000. I have even interviewed for some that are over 100,000. So it is definitely possible with your nursing license, and if you get a coding credential and you go into the right areas, and CDI, DRG validation, and any kind of auditing is going to pay really, really well. Compliance will definitely pays too, but I'm just not a compliance person. Like I'm not that much into policy and procedure and rules and regulations, but to those that are, that is definitely a lane that you should explore. And I just wanted to basically have do this video just to give you a quick side-by-side comparison so you can see, because I have always been an advocate for those who don't want to go back. If you're an LPN, if you don't want to go back to get your RN, or you're not able to really, really consider medical coding. It is a worthwhile profession. It is definitely worth your time. It will definitely make very good use of your clinical skills and your license, and you can have all kinds of growth potential. You can move up, you can move around, and most of all, you can work remotely. So if you get a remote job, if you want to move to another part of the country, you will still keep your job. You just hook up to a new Wi-Fi once you get settled. So there's a lot of opportunity available. And if you are interested in learning more about how to transition as an LPN into medical coding, by all means, continue to follow this channel. I ask that you like, share, and subscribe. And if you want to know more information, please visit thecodingnurse.com. My website has a lot of information. And if you're interested, you can also contact me via my website to send me an inquiry, and I will definitely get back to you. So if you made it this far, thank you for watching.